How are you?
Great, how are you?
Good.
My name is Ellen. I'm going to be your nurse today.
Nice to meet you.
Thank you, too. Could you tell me your name and your date of birth?
I'm Michelle Quinn, July 7th, 1983.
Okay, could you tell me where we are?
We are at 115 Jacqueline Ave.
Very good. And what brings you here today?
I have the tour assessment.
Yes. And what is today's date?
Today's the 30th of
Okay.
July.
Very good. Level of conscious times 3. I'm going to do a full head to toe exam on you. We're going to start from the top. We're going to go to the bottom. Before we came in, we did a full set of vital signs. Her blood pressure was 118/76. Her pulse rate was 64. Respirations were 16. We took her temperature. Her temperature was 98.4. I observed her entering the room. She did have a steady gait. She is dressed appropriately for the weather. She does have a relaxed posture and affect. Her skin looks appropriate for ethnicity. Good hygiene, checking her skin, checking her nail beds. I have your full history here, so as we go through everything, we will touch on it as we go to the different body parts, okay? If you have any questions, you can ask. We also did a visual test for a Snellen chart before we came in, and with her glasses, she's able to see 20/20. Okay, so we're gonna start with your head. I'm gonna feel if you have any lumps, bumps, infestations. Let me just put my gloves on first. Have you had any head trauma?
No,
Okay, do you suffer from any kind of headaches?
I have nothing.
You have migraines? Okay, all right. Feel her head and take a look. Okay, everything looks good. If you don't mind taking your glasses off, I'm gonna check the bones on your face, and then we're gonna do your eyes. So I'm gonna put your glasses down here. I'm gonna palpate her sinuses, her bones. I'm gonna check her pulses, temporal pulses. Okay, I'm gonna have you open and close your mouth. Very good. Okay. Now for your vision, I'm gonna check the 6 signs, cardinal signs. So just follow the light with your eyes, not your head, okay?
Okay.
Oh, okay. Okay, very good. Now we're gonna cover one of your eyes, okay? And then I'm gonna check pupils are responsive. We're gonna do the next one now. You cover that one. Pupils equal and responsive. At this point, we would lower the lights to check for accommodation and red reflex. Okay, I'm gonna palpate, just close your eyes and feel around your eyelids, and I'm gonna check. I'm gonna pull your lower eyelid down, okay? Her conjunctiva is pink and moist, and sclera's are white. Very good. Now I'm gonna check your ears, okay? First, I'm gonna feel around. I'm gonna do this one so we can see. Okay, I'm gonna feel around there. All right, I'm gonna look in your ears. Okay, tympanic membrane is gray and pearly, as it should be. No drainage. Do you have any problems hearing?
No.
Okay, all right. Are you around anything that would affect your hearing, any kind of loud noises?
No.
Okay, if you were, you would wear protective hearing, okay.
Right.
Okay, very good. Also, gray and pearly. Okay. I'm gonna give you your glasses back so you can see.
Thank you so much.
You're welcome. Now I'm gonna check your nose. I'm gonna have you cover your one nostril and blow out. Okay, and do the other one. Okay, good patency, equal bilaterally. I see no deviated septum, no drainage. Do you suffer from seasonal allergies?
No.
Okay. All right, I'm gonna check your mouth now. I'm gonna have you open up, say ah. Okay, stick out your tongue. Very good. Her uvula is in the center. She does have her tonsil still. Everything looks good, pink, moist. Her dental hygiene seems good. You can close your mouth now. All right, I'm gonna check your cranial nerves 5 and 7. For 1, I'm gonna put something on your face. I'm gonna do your forehead, your cheeks, and your chin. You're gonna tell me if you feel something sharp or soft, okay? All right, close your eyes.
Sharp.
Okay. Cool.
Soft.
All right.
Soft. Sharp.
Okay. Cool.
Soft. Sharp.
Okay, very good. Now I'm gonna have you, can you scrunch your forehead up for me? Okay, and then poof out your cheeks. And smile. Wrinkle your nose. Okay, everything is equal bilaterally. Very good. I'm now gonna move on to your neck. Do you have any kind of thyroid issues or have you had thyroid surgery?
No.
Nothing? Okay. I'm gonna go to the back and I'm gonna palpate your thyroid, okay? Okay, go ahead and swallow. Very good. All right, I'm gonna come back around. I'm gonna feel your carotid pulses one at a time, okay? Okay, +2. Pulses felt. I'm gonna listen for any bruies. Breathe normal. Okay. Very good. I'm gonna check your lymph nodes. Have you had any colds or anything recently?
No.
Okay. All right. Very good. I'm going to check your jugular vein. If you can put your ear to your shin. Okay. She doesn't seem to have any bulges. Okay. Very good. And then the other side. Very good. I'm going to have you press your head against my hand. Okay.
Sorry.
Go ahead and push towards me. Very good. And then the other side. Very good. Okay. Now I'm going to move down to your chest. I'm going to listen to your lungs. Do you have any kind of asthma, congestive heart? Okay. Have you received your COVID vaccine?
Yes.
Very good. Have you had COVID in the past?
No.
Okay. All right. And no recent lung infections or?
No.
Okay. All right. I'm going to listen to your lungs. First with the diaphragm, just breathe in and out. In and out. In and out. Okay, listen to the side. Okay, I'm gonna feel the bones. Okay. All right, no pain?
No.
Okay, looking at the skin on her chest, it is equal. I see no blemishes, no lacerations, no bruises. Okay, and do you wear sunscreen when you go out in the sun?
Yes.
Very good, at least the 30 SPF?
Yes.
Fantastic. Okay, I'm gonna listen to, for any murmurs. So I'm gonna have you just lean forward, okay? I'm using the bellows stethoscope. Okay, you can lean back. Okay, now I'm gonna listen to all of her heart sounds again. Her lungs were equal bilaterally, no crackles, no wheezing. When was the last time you had an asthma attack?
About a month ago.
Okay, all right, lungs sound very good. I have heard no heart murmurs. I'm gonna listen to the regular heart sounds. At this point, I would listen to her apical pulse for 1 full minute. Okay, I'm not gonna really do it for a minute. Okay, I'm gonna listen, I'm gonna go down to your back. I'm gonna listen to your lung sounds in the back now. Just lean forward for me. And breathe normal. Okay, while I'm back here, I am going to palpate over your kidneys, okay? So just lean forward for me. Okay, I'm going to percuss, all right? Percuss over the kidneys. Very good. All right, you can lean back. Okay, since you're sitting up, I'm going to do your upper extremities now. Okay, looking at your arms, you have appropriate hair growth throughout the arms. Check her capillary refill, under 3 seconds. Do you have any kind of numbness or tingling in your hands?
No.
No? Okay, very good. I'm gonna listen, I'm gonna feel for your brachial pulses at the same time. Equal bilateral. Okay, radial pulses. Equal bilateral. Okay, I'm gonna do a test for carpal tunnel. I'm gonna have you just go like this with your hands, okay? Very good. Does that hurt at all?
No.
Okay. All right, I'm gonna test your strength. So I'm gonna put my hands down, you're gonna press on my hands, okay? Very good. And then I'm gonna put my hands up and you're gonna pull up. There we go. Push up. Here, so you have your hands like that, and then push up to me. Very good. And then squeeze my hands. Great. All right. So does it hurt your wrist at all?
No.
Okay. This one?
Nope.
Okay. How about your elbow?
Nope.
All right. This side?
Nope.
Okay. And then lift your arm up. Does that hurt?
Mm-mm.
All right. Push your hand down onto mine. Very good. Okay. And lift this arm up and push down. Okay. Have you had any surgeries? Anything on your arm?
Nope.
Okay. Very good. All right, I'm gonna have you lay down now, so I'm gonna do your abdomen.
Okay.
All right. When you lay down, just lay on your left side at first. I'm gonna listen to her heart as she lays on her left side before we start her abdomen. Okay. Okay. All right, you can lay down. Here we go. Okay, so now moving down to her abdomen. Do you have any pain in your stomach?
No.
Okay. When was your last bowel movement?
This morning.
All right, do you suffer from any diarrhea, constipation?
No.
Okay. And when was your last menstrual period?
That's mine.
Last month? Okay. All right, so first I am going to look at her abdomen. And her skin looks good. Again, no lacerations, appropriate color. I see no lumps, bumps. I see no contusions. Nothing is abnormal. Now at this point, I'm going to listen. I'm going to listen for her bowel sounds first. Bowel sounds heard in all 4 quadrants. I'm going to listen to your abdominal aorta. Hepatic vein. Okay, now I'm going to percuss over your abdomen. Okay, tell me if this hurts.
Nope.
Okay, have you ever had any surgery on your stomach?
No.
Okay, and you weren't diagnosed with any chronic abdominal problem?
No.
Okay, so I'm going to feel, I'm going to go light and then I'll go deeper, okay? Does this hurt?
No.
Okay, this hurt?
No.
This?
Nope.
And this.
Nope.
Okay, very good. I did hear bowel sounds. There seems to be nothing abnormal. I didn't hear any bruise. I'm gonna now move down to your lower extremities. Okay, by looking at her legs, skin is appropriate. I see no lumps, bumps, contusions. I see no edema. I do see hair growth normal on both of her legs. Her cap refill is under 3 seconds. I'm gonna check for edema. I see no varicose veins. I'm gonna check your popliteal pulses. Okay, check your femoral pulses bilaterally. Okay, check her inguinal area. I do not see any hernias or feel any. I'm gonna check her pedial pulses now. Okay, equal +2 bilaterally. I'm also gonna check the movement in your legs now, okay? So go ahead and press your foot against my hand. Very good. Check in between her toes. Sorry if that tickles. All right, press your foot. Very good. All right, I'm gonna have you just bring your leg up at your knee. Okay, does that hurt?
No.
Okay, and this side? Any pain?
Nope.
Okay, and then lay on your side. I'm gonna have you lift your leg up. Okay, and then the other side.
All right.
Check your range of motion.
Okay.
Okay, very good. You can lay back normal. Do you have any pain in your legs, any tingling in your extremities?
No.
No? Okay. And no surgeries on your legs, on your feet?
No.
No corrective? Okay, very good. What I'm gonna have you do is you're gonna sit up and just hang your legs over for a second so you can kind of catch your bearings.
Okay.
Okay. Then I'm gonna have you stand up, but keep your eyes closed, okay? I'm gonna help you up. Do you feel dizzy at all?
No.
Okay, negative Wrongberg test. What I'm gonna do is I'm gonna check your musculoskeletal system, so I'm gonna have you walk. I'm gonna come over here. Walk to the door. You're gonna take a few steps on your heels, a few steps on your toes, and then walk the rest of the way normal, and then walk back 1 foot in front of the other, okay?
Okay.
All right, go ahead. Very good. Great, now you can just walk normal. Okay, and then 1 foot in front of the other coming back. Very good. Okay, now I'm gonna have you put your arms straight out and touch your nose on each side. Okay, wonderful. Okay, and I just need you to bend down and kind of touch your toes. I'm gonna check for scoliosis here. I'm gonna check your spine. Okay, your spine does feel straight. Okay, go ahead and stand up. All right, I'm gonna have you come on and have a seat. I'm going to put 2 items into your hand. All right, you're gonna close your eyes and tell me what I'm putting in your hand, okay? All right. Okay.
Tissue.
Very good. All right, your other hand. What does this feel like to you?
Paper.
Okay, yes, it is a little buff. Very good. All right. All right, and for your hearing, I'm gonna do a whisper test. All right, so just close your one ear, close over your one, and I'm gonna whisper on this side.
3.
Okay, and then do the same thing for this one.
3.
Okay, very good. Okay. All right, that concludes our exam today. I wanted to thank you for your time. The doctor's gonna come in and go over everything with you. He can discuss your migraines with you, since you have been having problems with that. Everything else looks good. No infestations, no lumps, bumps, bruises. I heard all quadrants of the lungs, or of the abdomen. She did not have hypo or hyperactive bowel sounds. Her lungs were clear, no wheezing, no crackles. I heard all of her heart sounds, S1 and S2, no murmurs, no bruits in the carotid arteries. She did have full range of motion in her arms, in her legs. I felt all of her pulses bilaterally, +2. She had capillary fills under 3 seconds, no edema, normal hair growth. Skin is completely appropriate. She does wear her sunscreen in the summertime. She got her vaccination, so she's in good health. She's just here for a normal physical. All right, so thank you again. Any questions you may have, you can ask me or the doctor, but I'll exit now so you can get dressed.
Thank you so much.
All right, thank you.
Appreciate it.